Assalamualaikum and hi, my name is Nurhidayah binti Nasir, a final year student from Medical Physics Program, School of Physics, University Science Malaysia. Today, I am going to talk about magnetic resonance guided cardiac intervention. First, let us have a look what is cardiac intervention. Cardiac intervention is a non-surgical procedure that deals with catheter-based diagnosis and treatment for heart disease. This includes the coronary artery, vascular and structural heart disease. These procedures are minimally invasive as there is no large incision required. This procedure is guided by a real-time imaging system, usually a real-time X-ray. The main example of cardiac intervention procedure are cardiac catheterization and percutaneous coronary intervention (PCI) or angioplasty. Other examples include the balloon angioplasty, stent implantation, radiofrequency cardiac ablation, and many more. Cardiac catheterization is the diagnostic procedure of cardiac intervention that evaluates the presence, location, and size of the plaque deposit in the arteries. This procedure also assesses the strength of the heart muscle and the function of the heart valve. In this procedure, a catheter, which is a thin flexible tube, is inserted into the blood vessel in the leg or wrist and is gently guided towards the heart. Contrast agent is then injected into the arteries of the heart so that the cardiologist can trace the movement of blood through the arteries and the chambers of the heart. If there are any blockage detected, the cardiologist may proceed with the angioplasty. The goal of angioplasty is to open up a coronary artery to restore the blood flow. In some cases, a catheter with a balloon at its tip is guided up. The balloon is inflated at the side of the blockage, stretching up to open the walls of the artery. A small metal coil or mesh tube called a stent may be placed in the artery. The stent is implanted to keep the newly opened arteries from collapsing. The cardiac intervention procedure can be guided using the real-time magnetic resonance imaging (MRI). MRI is the one of medical imaging modalities that doesn't involve the use of ionizing radiation. MRI is based on the principle of nuclear magnetic resonance (NMR), a spectroscopic technique to obtain the microscopic chemical and physical information about molecule, specifically water molecule. MRI gives a high-quality image of human soft tissue and provides superior soft tissue contrast that is not possible with other medical imaging modalities. The real-time MRI is referred to the rapid and continuous acquisition of image dataset followed by the image reconstruction and visualization. So, what is needed in order to perform MRI-guided cardiac intervention? Of course, the first thing that we need is a real-time MRI scanner, a noise-cancelling headphone, as the MRI scanner produces a loud sound, a contrast agent, which is gadolinium, and the MRI-compatible catheter and guide wire. The advantages of MRI-guided cardiac intervention is that MRI involves no ionizing radiation, which brings a big benefit in compared to the conventional real-time X-ray. Also, MRI provides a better soft tissue visualization and characterization and gives a better quantification of ventricular volume and vascular flow. There are several limitations in this process as it is not suitable for the patient who have heart pacemaker or any foreign metallic body as the magnetic field will dislodge the metal. The MRI-guided cardiac intervention is not yet ready to be widely used in clinical setting due to the need of MRI-compatible catheter and guide wire. There might be the presence of ferromagnetic component in the braiding of the catheter, which is not safe to use with MRI. Consequently, nylon, polyester, or other fibers can be a solution in the development of fiber-braided a catheter that is compatible with MRI scanner with improved mechanical properties. In the meanwhile, the guide wire is a thin, flexible medical wire that is inserted into the body to guide a larger instrument such as catheter. The conventional guide wire is made out of nickel titanium, which is an austenitic material that is safe to use in MRI. But in the presence of radiofrequency coil, the RF coil will induce the heating of guide wire, which make it not safe during the MRI guided cardiac intervention. Fiber reinforced polymer design were introduced in the development of MRI compatible guide wire. It gives a better mechanical properties such as high bending stiffness, comprising the continuous visualization of catheter during the intervention process. There are many research and development are still ongoing to provide a better mechanical properties and visibilities of these MRI compatible devices. This allows a larger array of MRI guided procedure to be investigated and to be applied clinically in the future. This is the end of this video. I hope that all of us can get a new knowledge regarding the application of MRI in cardiology. That is all from me. Thank you.